Chiropractic and sciatica. Sciatica is a condition where there's irritation on the sciatic nerve. Sometimes it's direct, sometimes it's inflammation irritating that nerve. But basically the sciatic nerve branches off the lower spine and runs down the back of the leg. A lot of times patients will experience pain, not only in the back, but into the glutes, the butt, and into the hip, and down the back of the leg, even can go as far as the toes. The other symptoms that accompany this typically is numbness, tingling, pins and needles, and sometimes even weakness when it gets really bad. Walking can be very difficult. Standing for long periods of time can be difficult. Going from a sitting position to a standing position can also be difficult. A lot of times the culprit is the disc. The disc is in the center of the spine here. It's sandwiched between the two bones. So what happens is when there's injury and there's unequal pressure on the actual spinal unit, it will push some of that disc material out and can irritate the nerve. When it's irritating the nerves in the lower spine, it has the ability to affect the sciatic nerve distribution. This happens typically because the spine gets injured. Joints get locked, they don't move, it creates inflammation, and then it starts to irritate that nerve. Or it's a direct trauma where that disc gets shot out. I want you to think of that disc as kind of like a jelly donut. And if we were to push on one side of the donut where there's unequal pressure on the spine, or the spine is hit in a certain way or fall a certain way, where it causes that disc material to come out into where the nerve is and can irritate that area as well. Chiropractic adjustments are very helpful in restoring proper function into this joint, aligning it better, distributing the weight evenly throughout the spine where it's not pushing on one side, and ultimately allowing your body to heal. That's what chiropractic adjustments do, allow your body to heal better, to function better, to move better. So very important to consider chiropractic care as your first line of defense when dealing with sciatica pain. Now, if it doesn't, chiropractic can help. There's other modalities that are available, like spinal traction, spinal decompression, and then of course other disciplines like physical therapy and acupuncture. These are all natural measures you should take before you go ahead down the road of any type of medication like a steroid or an injection into the area, or even obviously surgery, worst case scenario. If you're dealing with any type of sciatica pain, you would like help, shoot us a message, give us a call, and we'd be happy to help.